This video is on anti-anxiety agent, and this chapter is actually quite important for dentistry because we're always going to see, or I shouldn't say always, but it is very common for patients to come in being very anxious. And so there are drugs that these patients can take that can treat that anxiousness for a short period of time. Remember, it's important to use non-pharmacological methods first, so try to avoid using drugs to make them feel comfortable. And you can, instead of bringing them to the dental chair, bring them to an office, talk to them about their concerns. Maybe they're just fearful of the instruments, and if they are, then let them hold the instrument and, realize that it's not as scary as it looks. Maybe it's the noise that scares them, and if they are, suggest, a headset with music. Maybe they're just uncomfortable lying down completely on the chair, and so if they are, we'll keep them in an upright position or a semi-upright position. So always try to treat their dental anxiety without using medications, and then if absolutely. So again, always use non-pharmacological methods. So no medication if possible, and if absolutely needed, then use medication. So let's look at medication that it can be used in dentistry to help alleviate the anxiety in our clients. So there's a whole bunch of drugs listed over here, and we're just going to talk about the first 5 in detail. Okay, so what this slide over here is saying is that when our clients are relaxed, it's going to be easy for the patient, it's going to be easy for us, and it's even going to be easy for the dentist. So understand that it's very important to have a relaxed patient. Be empathetic towards the anxious client, because and so when I say empathetic, you need to be understanding, you need to show compassion. This is a serious issue, and we need to help them with that issue. We need to help them alleviate the anxiety part, and because when we do, the dental appointment will go so much better. They will feel better, we will feel better. So the first drug that we're going to look at is benzodiazepine, and benzodiazepine are actually the most common drugs that are given for short-term anxiety. And I say short-term because you only take it for that period of time where you need it, like in a dental setting, and then you don't need to take it forever. You don't need to take it for long-term. So when you look at benzodiazepine, it's actually available as a tablet, which is what we see here, or a capsule. It could even be given orally. It could be a gel that you put from behind, so rectally. It could even be injected. And it is broken down in the liver. And what it does is it goes straight to the brain, and it slows everything down in the brain. It actually causes CNS depression, where it slows everything down in your brain. And if we look at the different drug names, the generic name of the benzodiazepine, you're going to notice that they either end in PAM or LAM. So majority of them, right, they end in PAM or LAM. And they all have a Z in them. So there's always a Z, or ZO or ZE. So Z, ZPAM or ZOLAM, right? ZPAM or ZOLAM. So they have a Z in it, and they have either PAM or LAM in their generic name. So that's a good way to identify. Whenever you see this in a case study, in the board exam, or in your test, for example, anything that ends in LAM or PAM, and it has a Z, for example, before it, you know it's a benzodiazepine. You know that this drug is for anxiety. And there's other uses for this drug as well, which we'll look at. So how does this drug work? How does benzodiazepine work? Well, have you guys heard of Gaba? Gaba is a neurotransmitter. Gaba is like a chemical messenger that we have in our body. And so this is the neuron, and here is Gaba, and then this is the other neuron, and sending a message to the other neuron. When we have lots of Gaba in our body, this neurotransmitter that kind of rains down here, it's a good thing because it helps us feel calm. So what benzodiazepine does is it enhances the effect of Gaba. It makes the GABA stronger. It makes the GABA work more. It makes the GABA make us feel even more calm. So we have GABA in our body. When we take benzodiazepine, it's going to make GABA work more. It's going to enhance it. It's going to facilitate this so that we feel more calm. And when we feel calm, our symptoms of anxiety gets reduced. So what does it do? What does benzodiazepine do? It helps relieve our anxiety and panic attacks. So if we're very anxious at the dental office, or if we're feeling very panicky, and if you take a low dose of it, it will relieve, or it will alleviate our anxiety. But if we take a high dose of benzodiazepine, it can make us fall asleep. So it makes us very drowsy. So that's what we know, that's what we would use it for in the dental office. But sometimes the other uses for benzodiazepine is they're for seizures. So they stop seizures like diazepam, and they even help relax muscles. So it's for muscle relaxation. So people who have CP, cerebral palsy, or people who have paraplegia, for example, their muscles are always constantly, moving. So to relax their muscles, benzodiazepine may be prescribed. Now, people who have generalized anxiety, so they're always anxious, we don't give them benzodiazepine. With people who have generalized, or they're always anxious or panic, they take antidepressants. And there's a whole other chapter about antidepressants, but this is important to know. This is only for a short-term use. So benzodiazepine should technically, for dentistry, should only be used for a short-term use, because it's only used to treat the anxiety and panic for that appointment. For that dental appointment. Benzodiazepine it's known to be safe. There's another drug which we'll look at right after that is less safe. So this benzodiazepine is more safe. And this one is saying that so the frequency it differs. So if you take a low dose, for example, type of benzodiazepine, it's going to help with anxiety and panic attacks. If you take a high dose, it's going to affect sleep. Also, there are some benzodiazepines that have a long half-life, which means it's going to stay in your body for longer. And those drugs that stay in your body for longer have more side effects. The ones that have a shorter half-life, that kind of leave your body quicker, they have less side effects. So the side effects differ based on whether we take a drug that has a long half-life that stays in your body for a long period of time, or whether you take a drug that has a short half-life that kind of excretes or leaves your body in a short period of time. So long half-life drugs have more side effects. And so what are those side effects? Well, we know benzodiazepine, they cause CNS depression, right? They slow down the brain. And so you feel tired, you feel drowsy, your muscle might feel weak. We have another thing that can happen is ataxia. So this term, ataxia, is basically when you have poor muscle control and you become a little clumsy. So it's hard for you to walk. It's hard for you to balance. You don't have that hand coordination. It's hard for you to speak and swallow sometimes. And your eye movements are not, normal. So ataxia is like clumsy voluntary movements, and that is something that can happen. So these are the side effects. Now, there are people who and this is, by the way, this is very common in elderly individuals. So in elderly individuals, we see this more. In a psychiatric patient, so in patients that have some mental disorders, the opposite can happen, where instead of the brain getting slowed down or depressed, the brain is more stimulated. And so now we're talking more, we were even more anxious, we have nightmares. So the opposite effect can happen in individuals that are psychiatric patients. Okay, so when we take benzodiazepine, which is used for anxiety, one of the actual good things about it is it causes amnesia, and it causes anterograde amnesia, which is basically you forget. So amnesia means forgetting. You forget things that happen in the future. So if I take this drug right now, I'm going to forget about that traumatizing dental appointment that I had. Sorry, so basically I'm in the chair. Let's start again. So let's say I took this drug 10 to 15 minutes before the appointment. I go for the appointment. I leave the appointment, and I'm hoping because of this amnesia, it's a good thing because I will forget about that unpleasant dental procedure. So anterograde amnesia is you don't forget everything before, you forget everything ahead of you, which is the dental procedure, and then you get your memory back after that. So that's always a nice thing. They forget about that unpleasant procedure. It's also, another effect of taking a benzodiazepine is that one of the worst things that could happen is respiratory effects, which is like the worst thing is respiratory depression, where your lungs just shut down and you can't breathe. So this is more common in elderly patients, and it's more and it can happen more when someone is on opioids or when someone is drinking alcohol. We see this a lot more then. So when you mix it with opioid drugs or alcohol, respiratory depression can happen. Cardiovascular effects can happen. So benzodiazepine slows the body, right? So it's going to lower your blood pressure because it slows your body. It's also going to lower the pulse rate because it slows your body. And then the dental effects that we should know is that, and this is interesting, it can cause xerostomia, but it can also, for some, cause more saliva. So it's the opposite. So sometimes some people have xerostomia or dry mouth, and some people have increased salivation. So that was kind of interesting to see. It can also cause like a swollen tongue. Your taste might be off, so you'll get a bitter or metallic taste. So these are all side effects that can happen to individuals that take benzodiazepine. Never, ever, ever take it when pregnant because it can cause congenital malformations. They say you can get like a cleft lip or cleft palate from this drug, and floppy infant syndrome can happen. So this is a normal baby. This is a baby who can't hold themselves up, right? So this is a floppy infant syndrome, which is common in women or in pregnant women that take benzodiazepine. So it can negatively affect the child. Now this can be abused. Now I know opioids can be abused, but so can benzodiazepine. People can get addicted to benzodiazepine. They're dependent on it, and they need the tolerance. That means they need more and more and more drugs because the first, dose is not working for them. So they need a higher dose. So it is addicted. It is possible for it to get abused. And so the drug of choice for abuse, if someone has overdosed on benzodiazepine is this one, flumazenil. So flumazenil is the drug for benzodiazepine. Naloxone is the drug for opioids. Okay, so flumazenil is the one for benzodiazepine. So some interesting facts is that it does interact with other drugs. So benzodiazepine, if you take another drug, it can increase or decrease its effect. Smoking reduces their effectiveness. So if we're a smoker and we take benzodiazepine, the anxiety might not be as relieved. If we're taking it for anxiety, it might not work as well because smoking reduces the effectiveness of that drug. Okay, so medical uses. Why do we use it in medicine? To treat short-term anxiety or panic attacks. Sometimes we do conscious sedation, and this is especially for kids, right? When they have a dental procedure that needs to be done, they might be given this drug right over here, midazolam. So midazolam is one that they can give through IV and is commonly used in oral health care. It's used a lot for kids for conscious sedation. So they're awake, but they're sedated, but they're awake. It's also used for insomnia management. So if you can't sleep sometimes, because we know benzodiazepine causes drowsiness. It's also used for seizures, especially diazepam or lorazepam, because this can treat seizures. People who are alcoholics, sometimes using this can help with the treatment of alcoholism, and it helps with muscle spasms, which we also touched on. So if you have cerebral palsy, this may be prescribed. So what should we know? Why is this important for us in dentistry? Well, we know that it's a CNS depression, which means it's going to slow down our brain. So don't take alcohol. Don't take, before prescribing or when the dentist is, or a doctor is prescribing it, see if they're using any other depressants like alcohol, because alcohol also depresses the brain. Never take it when pregnant because it can cause congenital malformations, cleft lip, cleft palate. It can cause floppy infant syndrome. Document all the medications the client is taking. Remember, it can cause sedation or amnesia. So they tell them about that. Tell them that it'll make you tired. Tell them that you might forget the procedure. Arrange transportation. So this means that they're going to feel drowsy, so they can't drive on their own. And don't just tell them what the post-op instructions are about the dental procedure. Write it down for them, because remember, amnesia is common. They're going to forget what you say. So write it down for them. And then monitor vitals, because we know respiratory depression where they completely stop breathing can happen with benzodiazepine. So vitals need to be monitored so that they are stable when they're on our chair, when they're in our chair. Okay, barbiturates is another drug that is also used for anxiety. However, it is not as common anymore. In fact, benzodiazepine have completely replaced barbiturates for treating anxiety or even treating insomnia. So barbiturates are used for anxiety, were actually used for anxiety and for insomnia, but now benzodiazepine are used because it's safer. You can still get addicted to barbiturates. It is, as you can see, it's associated with a high rate of abuse. What is it still used for, though? It's used for anticonvulsants, so for seizures, and it's used to induce general anesthesia. So if you need to put someone to, completely to sleep, then you use a barbiturate. But for anxiety, so for a dental procedure, an unpleasant dental procedure where they might be very anxious, benzodiazepine is used, not barbiturates. Someone were to take barbiturates for anticonvulsants, so for seizures, or to allow someone to go for a GA, so general anesthesia, it is absorbed nicely or through orally or through rectally. They don't really inject it like intramuscularly because it can irritate the skin. It is the same thing where it enhances the Gaba neurotransmitter. So remember, Gaba helps us feel calm. So barbiturates also help you feel calm. So it has the same mechanism, similar mechanism of action to benzodiazepine. And what does it do? It depresses your brain. It slows down your brain. Important to note that it does not have an analgesia effect. This means pain. So it doesn't, reduce your pain tolerance or pain level. And same thing with benzodiazepine. Benzodiazepine doesn't also help with pain. But what barbiturates does is it helps with seizures. So what are some side effects with barbiturates? Well, this is actually interesting. It's exaggerated sedative or hypnotic reaction. It can really put you to sleep. Like it's actually quite exaggerated when someone takes a barbiturate. It can also cause fetal harm. So just like benzodiazepine, this one can definitely harm the baby. And in elderly clients, the slowing of the brain or the CNS depression is exaggerated even more in elderly clients. So we want to be really careful when it is prescribed for an elderly client because they can feel very tired. You can get addicted to it. So there's a physical and psychological dependence. Physically, you need it. Psychologically, in your brain is craving it too. Tolerance develops. You need a higher and higher dose all the time. So people can get addicted to it. But you know how with opioids we have an antidote, we have like an antagonist called naloxone that can reverse the effects. And with benzodiazepine, we have another antidote, another antagonist called flumazenil. Well, with barbiturates, we don't have an antidote. There's nothing that can reverse it when someone is addicted. Now, when people take barbiturates, one of the things we got to look at is their history. Do they have a family history of this, of porphyria? So porphyria is basically a disorder of it could cause nerve or even skin problems like we see over here. It's like a liver disorder, and your liver makes this substance called heme, and heme is like part of hemoglobin in your blood. It's like a protein, and it's made in your liver. And so basically, there's no cure for this, but if you have this condition, a liver disorder, do not take barbiturates because it's just going to get even worse, and this disease will get even worse when you take barbiturates. So if you are, or if you know someone that's taking this drug, barbiturates, it can interact with different types of drugs. So if you take Tylenol, it's not going to work as well. So Tylenol won't work as well. If you take a birth control pill and barbiturates, your birth control pill might not work as well. So you might have to use other methods. If you take warfarin, it might not work as well as a blood thinner. So the drugs these drugs might not work as well when you take a barbiturate. It also can do the opposite. Instead of it not working as well, it can enhance the drug effect. So these drugs that you take can work even more, which means it could get even more toxic in your body. So let's actually look at these drugs. So we'll start with the first one. So this drug, disulfiram, is a drug used to treat alcoholism. So if someone is an alcoholic, we would give this to treat alcoholism. The second drug, which is called propoxyphene, this is an opioid drug, so it's used for pain relief. Phenytoin, this is a drug for seizures, also known as Dilantin. So if you take barbiturates and any of these drugs, it can really enhance your drug effect. So let's look at these words: ultra short acting, intermediate acting, short acting, and long acting. So ultra short barbiturates means that you take this drug, and here you can be using it through IV, and in a short period of time you fall asleep. This is the induction of general anesthesia. You go to sleep. So in a very, very short period of time, you fall asleep. If I say long-acting barbiturates, that means this drug takes a long time for it to kick in, and it also stays in your body for a long time. So it could be used for epilepsy. Sometimes they would use that because it's an anticonvulsant. Short and intermediate acting, remember, we don't use this drug anymore because it's replaced by benzodiazepine. But what this means, short and intermediate acting, is that if I say it's a short-acting drug, it means in a short period of time it kicks in, and in a short period of time it also exits your body. The same thing with intermediate. In a medium short or intermediate span of time, it kicks in, and in an intermediate or medium span of time, it leaves your body. Okay, there's another type of drug that's called buspirone or Buspar, and it's not a benzodiazepine. It's not a barbiturate. It is a sedative or hypnotic. Sedative means drowsiness. Hypnotics means like you're completely sleeping. Like sedative is like you're sedated, you're tired, but hypnotics is you're completely asleep. And so this drug is known as anxioselective. So anxio means anxiety, so it helps with anxiety, and it's selective because it doesn't put you to sleep actually. And so this drug does not put you to sleep. In fact, this drug, if you take this drug, you could drive a car right after, because there's no sedative. It doesn't really sedate you. So it's not for sleeping. It's not to help with seizures. It's not to help with your muscles. So it doesn't affect your driving skills. But it can help with anxiety. And you don't get addicted to it, so it's less habit forming. You don't get addicted to it. People who have liver issues can actually benefit from this drug. So it's the opposite of a benzodiazepine. A benzodiazepine, like Xanax, which, by the way, this Xanax, the generic word for Xanax, is alprazolam. So alprazolam is just like Xanax. And so remember, anything that ends in lam is a benzodiazepine. And so this one is sedative. This one when high dose, can put you to sleep or can make you tired, but not Buspar. There's other drugs as well, non-benzodiazepines, so they're not a benzodiazepine, and these are receptor hypnotics, which means they actually put you to sleep. Hypnotics means they put you to sleep. So they are used to treat insomnia. Insomnia is like people who can't sleep. That's what we call that they have insomnia. So these are the drugs that help treat insomnia only. So these are the ones that we use for insomnia. So sometimes we would give them, like this drug, for example, in dentistry, because if they're so anxious because they can't even fall asleep the night before a dental appointment, then they might be prescribed this drug to treat the insomnia, to allow them to go to sleep so they're well rested when they come in to see us for their dental procedure. Okay, there's this drug that's called Melatonin. So Melatonin, what it does is it helps you go to sleep. It treats insomnia as well. And so what it does is we have receptors in our brain that are like melatonin type receptors. And so this drug kind of binds to the melatonin receptor, and melatonin helps you fall asleep. You need a prescription for this type of drug, Melatonin. But melatonin, which is a hormone that we have in our body, in our pineal gland, for example, this comes at 9 p.m. So at 9 p.m. we usually have lots of melatonin that gets secreted into our body, and that kind of makes us feel tired. And so sometimes you can take melatonin as a drug. So it comes in a tablet, it comes as gummies, it comes as a sublingual spray, and it's used to treat insomnia. So this melatonin you do not need a prescription for. So melatonin is like over the counter. But this one, Melatonin, you do need a prescription for, because it's going to try to put you to sleep. Melatonin does the same thing. It tries to put you to sleep, but it's a naturally occurring hormone that we have in our body. It's also something you can just get over the counter as well, and it helps you fall asleep. Sometimes there are some side effects, so sometimes you just feel very tired throughout the days. You're just very groggy. You could cause depression, headache, cramping of your stomach, and you could just be very irritable. Okay, lastly, some things to keep in mind. When we're aiming for a sedation, remember that analgesia or pain does not happen. A pain relief does not happen. So from benzodiazepine, you're not going to get pain relief. From barbiturates, you're not going to get pain relief. You may get sedation, but you won't get pain relief. If you want pain relief and if you want sedation, then opioids could be used. But don't prescribe an opioid just for sedation, because only prescribe an opioid if you need pain relief. So if you need pain relief, then you can, and sedation, then opioid is worthwhile, but otherwise don't prescribe an opioid. If someone is anxious, it's not like they really need pain relief, they just need to get, to calm down a little bit. So a little sedation might help them, but not, so don't give them an opioid for pain, because they don't need treatment for pain, they need treatment for anxiety. All right, lastly, it's really important to educate our clients about the medication and about the negative effects of the medication. Tell them that it can cause amnesia, tell them that it can cause xerostomia or increased salivation, tell them that they need transportation to the dental appointment, they need someone to drop them and pick them up from the dental appointment because they can't drive because they're going to be too drowsy. And don't just resort to this medication, to benzodiazepine, when they're anxious. You just do it in patient management. Try using a proper psychological approach to patient care. Use the tips and tricks we talked about at the beginning of the video to encourage our client to be able to come to the dental office, be less anxious without using a drug. And if absolutely needed, then prescribe. Then the dentist can prescribe the benzodiazepine. All right, hopefully that was helpful. Thank you, guys.